Have you ever managed a patient whose blood cells, all of them, the WBCs, the RBCs, the platelets and the likes, all of them are in low quantities? Yes, fasten your seatbelt as I take you through pancytopenia. Alright, so pancytopenia is a condition affecting the bone marrow, whereby the bone marrow produces the blood cells in lesser quantities. So without wasting my time, let's take the normal, then we link it to the abnormal. So we are all having our bone marrow in the long bones. Alright, so in the bone marrow, we are having something called the undifferentiated mesenchymal stem cells. So the stem cells branches into two main cells, whereby we are having the myeloid cell and then the lymphoid cell. The myeloid cell has got to do with the blood component, that is the RBCs, the WBCs, and then the platelets. Then with the lymphoid cells has got to do with the specialized WBC, that is the lymphocytes. Alright, so in a normal human being, in a healthy human being, that is what is happening. So when the liver, the kidneys, they bring the ingredient, they bring the component, the erythropoietin, the thrombopoietin and the likes. The bone marrow will take it, then it will produce the blood for the human being to use. So in pancytopenia, something has happened to this bone marrow, and these blood components are produced in lower quantity. That is why we term it as pancytopenia. So any condition that can affect the bone marrow and let the bone marrow produce in lesser quantities. So the first one, we can have bone marrow suppression. We can have bone marrow suppression. Then also we can have cancer of the bone marrow, cancers. Another one is some people are having genetic conditions, so we can have genetics. Then also a patient having leukemia, so we can have leukemia and the likes. Then we are having risk factors like the elderly and the likes, but those ones are not concrete because it's someone's research. Alright, so these are some of the causes. We can also have cytotoxic drugs, a patient taking chemotherapy and the likes. The patient is at risk of getting this pancytopenia. So the signs and symptoms that a patient having pancytopenia will exhibit depends on these blood components. When the WBC goes down, what will be some of the signs and symptoms? When the RBC also goes down, what will be the signs and symptoms? And when the platelet also goes down, what will be the signs and symptoms? So in RBC, the patient can suffer something called anemia. We can have fatigue. We can have confusion. Then also we can have risk of infection. We can also have dyspnea. Then also we can also have bleeding tendencies. So in bleeding tendencies, the patients will have something called petechiae. You can have ecchymosis. And then purpura. So these are all signs that the patient is bleeding, whether internally or externally. So these are some of the signs and symptoms the patient might present. So in your nursing management, this is what you are going to do. You need to check for any bleeding tendencies, and you need to put in measures just to prevent the patient from bleeding, or just to prevent the patient from getting into contact with anything that will bring bleeding. So example, you need to explain to the patient that there is the condition at hand. So the patient should, make the environment serene and also the room serene, so as to not to get into any contact with any sharp objects. Do not use any hard brush, just use soft brittle brush and the likes. Then also with the RBC, the patient is anemic. If the patient is anemic, you need to explain to the patient that the patient should not engage in any vigorous exercise. The patient should not engage in any vigorous exercise, as well as, whenever the patient should rest in between periods and the likes. And if the patient is having, since the patient will be at risk of infections, The patient will also practice personal hygiene just to help the patient from getting into contact with any infection. Then also with your treatment, you are doing pharmacological therapy. We can do pharmacological. With your treatment, you can do pharmacological and non-pharmacological, as well as surgery. So with the pharmacological, this is where you are going to give the patient drugs like the cytotoxic drugs. Then also you are going to treat the patient based on the symptoms the patient will be presenting. So if the patient is anemic, you are going to give hematinics, you are going to give antibiotics, you are going to give analgesics and the likes. Then with the non-pharmacological, that is the one that I explained earlier on. You are going to explain to the patient to put in measures, safety measures. Yes, then also with the surgical means, we can also do bone marrow transplant just to, remove the diseased bone marrow. Then we introduce a new bone marrow to the person so as to help the patient prevent this pancytopenia. Thank you. Like and subscribe. Bye-bye.